Hi everyone. Today we are going to start our Women's Wednesday Women, and we are going to share some information about STIs and women and how they affect them. So, hi Gladys, Gabriel, thank you for joining us tonight. And yeah, so if you have any comments, you can just leave your message there in the comment section, and then we can answer any question maybe you have for me and for my co-worker who are behind me here. So, as you already know, over the past few months, community health departments has expanded its outreach effort to social media platform to cover various topics on HIV and STI sexual health practices, access to care, social determinants of health, and general public health interventions. So this next series is gonna be focused in the pandemic COVID-19 and ways to manage your sexual, personal, mental health. And as you already know, the community health team is here to educate you and support you. So, thank you, Gladys. So, as you already know, the CDC reports they released last week that show how in 2019 report cases of prevalence of STD increased for six consecutive years already, reaching new all-time heights. So today we are going to be talking about how sexually transmitted infection and diseases, also called STI and STD respectively, affect women here around the city and around the world. So STI can affect women differently than men. For example, each year untreated STD can cause infertility in at least 24,000 women in the U.S. So untreated syphilis in pregnant women result in infant death, and it's up to 40% in cases of an HPV is the leading cause of cervical cancer. So today we only going to look for a few of STI. Some of them are gonorrhea, chlamydia, and HPV. And feel free to drop question to the comment section and let us know if you want to hear about more STI and how they can affect women around the U.S. So we are going to start with the first STI, which is gonorrhea. And as many of you already knows, gonorrhea is a bacteria, and also it's an estimate that around 1 million women are currently infected with gonorrhea. Here, contrary to the popular belief, gonorrhea cannot be transmitted from toilet seats or door handlers. So it can live outside of the body longer than for a few minutes, and now can live in skin or hands, so arms or legs. So you can survive only most surfaces within the body. That's why it's often spread through sexual contact. Gonorrhea is found most commonly in the vagina, cervix, urethra, and as well as the back throat for oral genital contact, and in the rectal too. Also, as you already know, also gonorrhea can be transmitted for oral. For example, is woman who is infected and other person is doing vaginal oral vagina can be also transmitted for the throat too. So, of a majority infected women have no symptom, especially in early stage of the infection. So, when women do experience signs or symptoms of gonorrhea, they include burning during urination, frequent urination, yellowish vaginal discharge, rednesses, and swelling of genitals and vaginals, itching and burning. So, if untreated gonorrhea can lead a third pelvic infection with inflammation of fallopian tubes and ovaries. Gonorrhea can also spread through the body to infect joints to cause gonococcal arthritis. So also gonorrhea infection is the fallopian tube can lead to serious painful infection of the pelvis known as pelvic inflammatory disease. So of PAD or PAD occurs in the significant portion of women with gonorrhea infection of the urine cervix. So symptoms of pelvic infection can include fever, pelvic cramping, abdominal pain, or pain with intercourse. So means if you are having pain where you are having sex with your partner, could be STI. So pelvic also infection can lead to difficulty becoming a pregnancy or even sterility. So, but the good news is that Statin Treatment is here, and it's really easy. Just go for a free STI clinic like one at Whitman-Walker. So we provide, as you already many of you already know, we do their free HIV and testing by appointment only. And it's super simple. You can just call us by 797 44 202-797-4439. And if you come positive, you meet with a medical provider and they can give you treatment to and you will be cured for the infection. Also, we are going to talk a little bit more about another STI called chlamydia, and chlamydia also STI and shares a lot of common with gonorrhea. So it's a common bacterial infection, actually more common than gonorrhea. So with more than 1 million women estimated to be currently infected now. So it's transmitted through sexual contact and can be found in the most commonly in vaginal, cervix, and urethra. So as well as the back of the throat. So from oral genital contact, and is the rectum too. So let's say hi to my people. So hi everyone again. Hi Kevin, Brendan, Yamilet, everybody who is joining us tonight. So as you already know, we are talking about STI and how can they affect women. So continue with the topic. So like with gonorrhea, and the majority of women with chlamydia do not have symptoms. So cervix's infection of urine cervix is the most common presentation in the clinic. So while about half of women with chlamydia cervix have no symptom, others may experience vaginal discharge or abdominal pain. So also infection of urethra is often associated with chlamydia infection. So of cervix, women with infection of the urethra or urethras can have the typical symptom of urinary tract infection, including pain upon urination and frequent of urine need to go to the bathroom. So again, like gonorrhea and chlamydia is very destructive and for the fallopian tube. So it can also cause several pelvic infection, and if it's untreated. So some women with chlamydia will develop pelvic inflammatory disease So because it's a common infected woman to have no symptoms. So chlamydia is an infection, is often untreated and result in intensive destruction of your fallopian tubes, fertility problems, and tubal pregnancy. So also chlamydia is infection is also associated with premature births. So in addition to the infant can acquire the infection during the pass through the infected birth canal, so leading to the serious eye damage or pneumonia. So that's why newborns are treated with eye drop containing with an antibiotic that kills chlamydia. So treatment for all newborn and routine because of the largest number of infected women without symptoms is one of the consequences of chlamydia eye infection to the newborn. Also, the good news again is testing and treatment for chlamydia, and it's really easy to get it. So just go for a free STI clinic. You can make us a phone call at 202-797-4439, and we can use help with any appointment you may need to do a STI screening. So now continue with the topic around we are going to talk a little bit more about HPV, also known as human papillomavirus, and it's very different from gonorrhea and chlamydia, and it's much more common here around the US. So in fact, HPV infection is considered to be the most common sexually transmitted infection in the US, and I believe that I majority to the reproductive I'm sorry. Reproductive age, genital population, and I'm sorry, I'm gonna say it right. So reproductive age population has been infected with sexual transmitted, and HPV also at some point in life can cause genital warts that are preliminary transmitted during the sexual contact. In addition to warts, HPV infections has no longer been known to be cause of cervical cancer and other of anogenital cancer in women. So HPV also is an infection common does not usually live with like developments of warts, cancer, or specific symptoms. So in fact, the majority of people infected with HPV have no symptom or lesion at all. So, but asymptomatic people, those with HPV induced wart and lesion who have HPV infection are still able to spread the infection through other people. And genital wart usually appear as small freshly raised bumps, but they can sometimes be extensive and have like cauliflower look-like appearance. So they may occur on on any sexual exposure area. So in many cases, just let me see. Okay, in many cases, genital warts do not cause any can sometimes be suspected but changes that appear on PAP smell or through PAP smells were not really designed to detect HPV. So in the case of abdominal PAP smell to the clinical, we often do advanced testing for material to determine if which kind of HPV may be present in the body from that person. So HPV also can also be detected if by a biopsy, and for example, from genital ward or from the uterine cervix. So it's sent to the laboratory for analysis. There is no cure, as you already know, to HPV is no cure, but has treatment. So again, is some of the person who was watching us here or who are going to watch us in the future, as many Whitman-Walker is doing free HIV and testing by appointment only. It's super easy to connect with us. You have to just call to 202-797-4439, and then we can make an appointment for you to be tested or screening for STI. So also there are a few ways to can stop the spread of an STD. So I'm gonna say some of them, and you can choose whatever you want to be using to to stop the spread of an STD. So using condom when you have sex is the more easier way to how to prevent or stop the an STD. So condom preventing against the transmission of gonorrhea, chlamydia, and syphilis, and they are really effective when used correctly. So what that means? So condom also to be more helpful, we can use the condom correctly, and we can also use lubrication to have better sensation while we are having sex, and also to help the condom to don't break. So also we have get tested. If you have been negative and you are having many partners, we recommend people to come to get tested every 3 months. And if you have been exposure, you can use callers back. You can use callers to make an appointment to see a doctor, and we can give you treatment to stop the symptoms. So also going along with that, make sure your partner get tested too. Using the same logic, if you partners get tested and their result come back negative, they can give you anything. So if your partners get tested and their result come positive, they can easily get treated so that they don't spread any infections to you. So also consider having mutually monogamous relationship. That way you and your partner only need to get tested once in a while, as long as you need to do it. So also you can get an STD if you already know if you are having sex with many partners. What we recommend, use them, do them every 3 months. Also, educate other about STI and their spread. So many people don't know how this information, and you can help with your friend, neighbors, and community by sharing this information too. Also, if people is watching and don't speak, for example, one language, and Google, we can find any information in any language. If you have not sure what we are wanting to say, and we can find easily there in Google extra information too. So Alexa, I am monogamous, and so in my partner. That practice help to us to not get any STD. Thanks, Lissa. Thanks, Alexa, for your comment. And let's see if we have any other here. Adriana, hey, Rama, thank you for watching us today. So we are going to continue with the topic. So also, so just to don't have sex at all. This is one can be difficult for some people, but others find comfort is having themselves and their only sex partners. So also get vaccinated if possible for gonorrhea. Get vaccinated if possible. Gonorrhea and chlamydia don't have vaccines, but HPV has a very effective one. So talk with your medical provider to see if you qualify, as the vaccine is typically only offered to those between age of 9 and 26. But you can just talk with your primary doctor, and he is the person who can tell you who if you really qualify for this vaccine or not. Also, what is a little scary about many STD is that they are asymptomatic, meaning you can't tell if you can have them. So some of them can harm your health even if you don't have symptoms, and you can always spread them to others. So if you are not sure if your status of use want to get it checked to be sure, Whitman-Walker is offering free HIV testing at least at our location list, and our location is in Northwest DC, and in our location in Southeast 2 MRC. You can make an appointment with us just calling you 212-797-4439. Also, the number is pinned there in the comment section. So if you any of you guys any people here have any question, you can use left the comment section, and then my coworker behind me can answer those questions, or if you have any concern of any of them, you can just call us and talk with us. We are really knowledge about, we already know everything about how they work, and we can just give a phone call at 202-797-4439, and we can guide you what to do, and we can also help you to get an appointment with us. So also, before I go, I want to give a few reminders about COVID-19 and the vaccine sites. So if you already gotten vaccinated, congratulations, you have taken really important step to preventing yourself, your loved ones, and your community from illness. So also, as many of us already know, Delta variant is soaring across the United States at the moment, and it's totally understandable why you may want to keep wearing your mask. So the vaccine is not 100% effective. More contagious variants are spreading. So there are very few protocols in place to actually verify that folks around you are vaccinated. So keep on stay alert. So also, if you have not been vaccinated yet and you are looking for an appointment, Whitman-Walker has COVID-19 vaccines available spaces. So everyone aged between 12 and 79 or more, you can receive a Pfizer COVID-19 vaccine, and everyone from age 16 and up are eligible to receive COVID-19 vaccine also. So please reach out us at 202-207-2480, and to make an appointment with us. And if you having trouble making an appointment, you can just call the main number 202-745-7000, and you can hear the comments there, and we can just guide you where you have to go to get one. So also, for DC resident, you can find information in COVID-19 vaccines walk-up location and eligibility at vaccinated.dc.gov, or by calling 1-855-363-0333, and track the spread of COVID-19 vaccination lines by visiting coronavirus.dc.gov/don't wait. Yeah. And for Maryland residents, learn more about the Maryland vaccines distribution process and schedule with vaccination appointment and COVID-19 for vaccination appointment at covidlink.maryland.gov or by calling 855-634-6829. Again, 855-634-6829. If you live in Prince George County, please visit their portal here. You can see in the comments, you can see where you can go to find more information for Maryland resident, and for Virginia resident, learn more about Virginia vaccine distribution process and schedule a vaccination appointment. You can go at vaccinate.virginia.gov or by calling 867-829-4682. Also, if you have been vaccinated yet and you are not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantine, social distancing, and the like. Is very important that you can vaccinate this COVID precautionary measure with those around you. So be mindful of the mask or keeping you distancing, especially when you don't know whether a person have been vaccinated or not. Also, if you want to support Whitman-Walker, you can register to walk through to the run and donate this year. It's going to be virtually, so you can do a registration at walk2endhiv.org. And again, thank you for being here every Wednesday with me. And just remember to follow us on Instagram, Facebook, and Twitter with Whitman-Walker. At checking our website Whitman www.whitman-walker.org, and for most update information in our services, or for more COVID-19 resources on general information from Whitman-Walker services, you can call us at 202-745-7000 for if you have any question. Also, user-friendly reminding for people who are interested in get free HIV testing. Just remember, it's by appointment only, and it's super easy to go in touch with us. Just call us at 202-797-4439 to make an appointment. And if you need Spanish, English, all of us are bilingual, so we can help you with anything. And if you have any other question, you can just dial the main number 202-745-7000. And if you don't know, if you, for example, want a medical appointment or any other go to other department, you can just dial 202-745-7000. Remember again, free HIV testing, free HIV and STI testing by appointment only. 202-797-4439. Again, thank you so much for being here with me on the Wednesday. For the people who are still here, thank you very much, and see you next week. Thank you again. Bye bye.